Assalamualaikum dear students, it's Dr. Masma Mehta. Welcome to my YouTube channel Medical School. Today I'll be explaining about anatomy of nasal cavity. So let's go. So the nose is comprised or it's divided into the external nose and the internal nose. So external nose, it's made up of the bony part and the cartilaginous part. So the bony part is formed by the upper 1/3 of the external nose, and then we have the cartilaginous part that forms the lower 2/3 of the external nose. Now you can see in this picture the two nasal bones actually unite together to form the nasal part of the external nose. So the bony part is formed by the union of two nasal bones. Come to the cartilaginous part. So as you can see in this picture, we have here the lateral nasal septa and then alar cartilage, septal cartilage. For your ease, we have divided the lateral septal cartilage into two compartments. So this is the upper one and then we have the lower one. So the upper lateral cartilage, the lower lateral cartilage, the nasal alar cartilage and the septal cartilages. Now come to the muscles of external nose. We have the procerus muscle and transversus nasalis muscle, dilator nares muscle. Whenever a person is angry, these dilator nares anterior muscles actually perform their function and the nares are actually dilated. Then we have the levator labii superioris and alar nasal muscle. So these 6 muscles forms the external nose. Now the internal nose is formed by the vestibule and the nasal cavity proper. So the nasal vestibule is the anterior and inferior part of nasal cavity and it's called as the nasal vestibule. Now this contains two valves. We have internal and external nasal valves. Now see here we have internal nasal valve and external nasal valve. This area is external and then we have here is the internal nasal. Here we have the internal nasal valve. So the nasal cavity is formed by the lateral wall, the medial wall and roof and floor. So we will be discussing these terms one by one. Let's start with the lateral nasal wall. So the lateral valve is formed by the 3 turbinates. We have superior turbinate, middle turbinate and inferior turbinate. Now these 3 turbinates, just behind these turbinates we have metatarsus. So again we have 3 metatarsus. Just behind the superior turbinate we have superior meatus. Just behind the middle turbinate we have the middle meatus and so on we have inferior meatus. Okay, now this is the superior concha or you can say turbinate. This is a superior turbinate. Now this portion is the medial turbinate and then we have the inferior turbinate. Now just inferior to this here we have just a second. So here we have the middle meatus, superior meatus, here middle meatus is here and here we have the inferior meatus. So the medial wall is formed by the medial wall or you can say the septa that actually divides the nasal cavity into 2 compartments. So this septa is formed by 4 cartilages and 1 union of the bony parts. So the nasal parts when unite together they form the nasal bone. So we have the ethmoid, the nasal bones and then septal cartilage, greater alar cartilage, vomer. Now in this pic you can see we have the ethmoid here, the vomer here and then we have the septal cartilage here and the nasal bones and greater alar cartilage which is responsible for your nasal bridge. So let's talk about the roof and the floor. So the roof is actually formed here. You can see the sloping area. Now this sloping area is formed due to the union of the nasal bones and here in posteriorly you can see here the body of sphenoid and here middle part is formed by the cribriform plate. So these 3 structures unite together to form roof of the nasal cavity. And then in the inferior portion here this is the floor. So the floor is formed by the hard palate and then this area that is the soft palate. Okay, the blood supply of the nose. It's again divided into the medial wall. The medial wall is supplied by the internal carotid artery and the external carotid artery. So internal carotid artery gives off anterior and posterior ethmoidal arteries, and external carotid artery gives off maxillary artery and fascial artery, out of which maxillary artery gives two branches here, the sphenopalatine artery and the greater palatine artery. However, the fascial artery gives only superior labial artery that supplies the medial wall of the nose. Now I will be describing or briefly describe I will briefly describe the blood supply of the medial wall by means of this picture. So internal carotid artery gives off two branches, anterior and posterior ethmoidal artery. Then we have the sphenopalatine artery, which supplies here the inferior aspect. Now these two branches supplies the superior aspect. This is a superior aspect, and sphenopalatine and greater palatine supplies the inferior aspect of the medial septum. Now the little area. The little area is actually area that is formed due to the anastomose of four major arteries. So we have the anterior ethmoidal artery. Remember, there is no posterior ethmoidal artery in the anastomose. And then we have the sphenopalatine artery, the greater palatine artery, and superior labial artery. So the anastomose at the level of little's area. And now what's the importance of this area? Here the Kieselbach plexus is formed. Now the importance is that the epistaxis occurs from this area. Anterior epistaxis occurs from this little's area. Now the lateral wall of the nose. So the blood supply of the lateral wall of nose, again we have internal carotid and external carotid. Internal carotid gives off anterior posterior ethmoidal artery, and external carotid we have the sphenopalatine artery, lesser and greater palatine artery, branches of fascial artery. Okay, so now you can see here the superior quadrant. So this is actually supplied by the sphenopalatine artery, and then we have here anterior ethmoidal artery, and inferior aspect you can see here we have the greater palatine, the branches of greater palatine artery, and the branches of fascial artery that supply this area. So that is very similar to the medial wall. Now these all arteries supplies the lateral wall of the nose. Now come to the nerve supply, which is a last topic. So the nerve supply of the nose. We have external nasal nerve here, anterior posterior ethmoidal branches here, septal nerve here, and the nasopalatine nerve here. Now one thing here is missing, that is the olfactory bulb, which is just located here. Now the olfactory bulb gives off branches, like we have the olfactory nerve, which is responsible for your sense of smell. So whenever you smell good, you can blame this, or you can, whenever you smell bad, you can even blame the olfactory nerve. Now remember, whenever there is injury or trauma to the olfactory nerve, the patient will be in the condition of anosmia, because olfactory nerve, whenever it's damaged, you cannot smell. So that was all about the anatomy, and if you understand, if you learn anything from it, you can tell me, or if you have any question or query, you can ask me in the comment section. Thank you. Allah Hafiz.